I believe we are live. Welcome to this live stream hangout. I'm Patrick Coffin. We do this once a month. Every week we do it inside Coffin Nation, but I like to open the doors every month and hit a newsmaker, someone who's saying important things about something culturally influential. And I'm honored to be joining this live stream hangout with Dr. Jeff Barke. He's a presenter in the upcoming Truth Over Fear Summit. The subtitle is Unmasking Covid19. By the way, if you're wondering what the ad meant, it said, take the truth, leave the fear. That was a line borrowed from the cannoli line from The Godfather, if you're scratching your head about that. We want to talk about what started off being called the novel coronavirus, then it was rebranded as COVID-19, and it's the thing in the news all over the world. What we're going to do today with Dr. Barke is separate some fact from fiction and maybe give you a taste of what's coming up at the Truth Over Fear Summit. The website for that, by the way, is restoretheculture.com. Fairly easy to remember, restoretheculture.com. Friday the 30th and Saturday the 31st of this month, 20 plus speakers from 7 countries. And so I'll introduce Dr. Barke now. He's a board-certified primary care physician in Southern California. He is a father and a husband and the co-founder and current school board chair of a free public charter school in Orange County called Orange County Classical Academy. And he's been a doctor with lots of bedside manner for decades now. Dr. Jeff Barke, thanks for joining us.
Patrick, thank you for having me. I appreciate it.
Was there a moment when you decided that there's something terribly wrong about the official grand narrative coming from the CDC and Dr. Birx and Dr. Fauci, and seems to have been in lockstep with every media outlet, almost like everyone's singing off the same sheet of music? Did you have one moment where you go, something's off here, something's being oversold?
Well, listen, the reality is I'll blame this on my wife. So there wasn't a moment. Most physicians, and I'm not any different, just want to go about their business, take care of their patients, go home at night, turn on a ball game, and just be a normal human being and do their thing. Mm-hmm. I think it was in April that my wife and I got invited out to Riverside. For those that don't know, Riverside is inland Southern California. We got invited out there because there was a Riverside County Board of Supervisors meeting. And what they were meeting about is to make a decision whether or not the county of Riverside would be open, whether the businesses would be open and so forth. So there was a group of activists that wanted to lobby those supervisors to open up the business. Mm-hmm. They invited my wife and I out there. I begrudgingly went along. And the reason why it was begrudgingly, because normally during non-COVID times, it's an hour and a half drive in traffic.
Yep.
Go from coastal Orange County to inland Riverside. Who the heck wants to do that? And I had a busy day at work. My wife reminded me that COVID times, there's no traffic and that we were doing somebody a favor and it'd be really nice to go out there. So we did, to support them. And while I was there, I was asked to say a few words on the steps before the supervisors meeting. Mm-hmm. And so I grabbed the microphone. I didn't have anything prepared. And as I went up, I said, "Hey, honey, take a couple pictures so we can send it to the kids later. I think it'd be kind of cool." I had scrubs on and a white coat. It's going to work later. And instead of hitting, we all do this, instead of hitting the photo button, she hit the video button. So I spoke for 5 minutes, maybe 6 minutes. And later, she then posted that on Facebook. And that was really the start of me going from just an ordinary doctor doing my thing, taking care of patients, minding my own business, to now a activist physician, because I started getting phone calls from literally all over the world, mm-hmm. from doctors, media outlets, patients, just various folks that resonated with what I had to say. And at the time, what I was saying, because we didn't know a lot about coronavirus, is I had a copy of the U.S. Constitution, Declaration of Independence in my mm-hmm. hand. Mm-hmm. And I made a comment that this document was not designed to restrict the citizens. It was designed to restrict the government. And what if the narrative that we're hearing is incorrect? Yeah. And I was pushing back, and I guess that message resonated with a lot of people. Some people like to call me courageous. I'm not courageous. I have fear just like everybody else. I have anxiety. I don't like being in the public. I've gotten a lot of criticism and it doesn't feel good.
Mm-hmm.
I've also had people thank me. So, what I really think is what courage is it's not acting without those feelings of having anxiety and fear and being hurt when people criticize you. It's doing the right thing despite those feelings. And
Yeah.
that's what I've tried to do. I've tried to put forward a compassionate but honest narrative. And I know it's different than what the mainstream narrative is. But that narrative needs to be heard. And I think I represent thousands of physicians across our country and across the world. I mean, I know I do because I've heard from them.
Mm-hmm.
Say, thank you. Yes, speak out. I agree with you. And I joined a group that's called America's Frontline Doctors. Got my lab coat on here.
That was going to be my next question. Yeah.
And there's, I don't know how many of us, 20 or 30 of us, and we've gotten together from time to time and have put on medical conferences, which I think are most important. We had one this past weekend in DC. It was a medical conference. I spoke on opening schools and the risk of COVID-19 to children.
Yeah.
Other physicians spoke on other aspects, hydroxychloroquine, wearing masks, the statistics, the risks, etc. And it was excellent. I spoke for about 15 minutes, other doctors 10 to 20 minutes. And then what we did afterwards, because we did this in order to get attention so people would pay attention because the media wants to ignore us, is we all went over to the Supreme Court. They have if you ever been there in Washington, D.C., it's really a beautiful building. And they've got these great steps that, unlike the Capitol and other areas of DC, is still accessible to the public.
Mm-hmm.
So we used the Supreme Court steps as sort of a mini press conference. We all spoke for about 2 or 3 minutes. I talked about schools and children. Others talked on other items.
Yeah.
A couple media outlets carried us, like One American Network. And our goal here is to bypass the mainstream media, talk directly to the American public, and say, listen, we think that there's much about the mainstream narrative that you're hearing that's incorrect. We think that there's a better path forward, one without fear, one that we think brings common sense.
Mm-hmm.
And that's what we were trying to get out to the American people. I think we did so effectively, but of course, our videos have now been taken down from YouTube, Twitter, Facebook, Vimeo, that video broadcasting platform, has taken all our videos off the air. So now if you go to our website, America's Frontline Doctors Summit, you can just use the initials.com.
Yeah.
You can see there are all our videos and the speakers, but they're no longer available to be viewed by the public because they've been taken down. Yeah. And Patrick, that's totalitarian stuff. This is America. You can disagree with me, and I'm cool if you do. And I learned from those disagreements and people pushing back saying, hey, doc, have you looked at this study? Have you seen this evidence? That's what science is supposed to be.
Yeah.
But to ban our voice on social media and social media platforms, that's what goes on in the CCP, the Communist Chinese Party, in Cuba, in North Korea. That's not supposed to happen in the United States of America. But yet here we are. It's happening. To mainstream physicians that have a perspective, and our perspective is being banned, and it's crazy.
Yeah, I was going to mention, as you were talking about your message being ignored, I was thinking that's kind of you'd have to apologize for those who are ignored, because you were not just ignored. The oligarchs that are running this grand narrative and enforcing it were playing whack-a-mole. In fact, that Dr. Simone Gold is another presenter at the summit that you're going to be presenting on, and it was her earnest, sincere, heartfelt, non-big whoop, just presentation going around the media machine. I think it was 20 million hits before it got banned by Facebook and YouTube. And then you did another one, and that also was enormously popular, spread all over the world, and that too got squelched. In fact, that was part of my inspiration for doing this Truth Over Fear Summit. Is I thought, why is nobody, whether in the media or in the medicine world, refuting these doctors? There's no refutation going on. There's no scientific method. There's no marketplace of ideas. You're being squelched, silenced, deleted, ritually shamed. If you plug in Simone Gold, Dr. Jeff Barke, another frontline doctor, Dr. Mark McDonald, will also be presenting on the effect of children in a world full of adults who are frightened wearing masks.
Yeah,
A lot of the information online is now written by your enemies.
that's right. And it's really unfortunate. And, the scientific method is really about scientists and healthcare providers and doctors sharing ideas and best practices and collaborating. Science isn't about you follow a single narrative without disruption. That's not science. That's not science. That's totalitarian thought.
Right.
And, locally in local hospitals and so forth, I'm used to doctors with differing opinions. You get together and you talk about it. You say, I've seen these patients and I've done this and I've looked at these studies and it seems to support this idea, et cetera. And you get pushback and they say, yeah, but did you see this study? And have you tried this before? That's how progress is made. It's about putting forward a hypothesis and then trying to prove that hypothesis wrong. That's a scientific method. Mm-hmm. But what's happening now is we have one scientific narrative that's being put out, and anybody that disagrees with that narrative, their ideas are not shot down and pushed back on. Mm-hmm. The individual is pushed back on. We're called names. I'm called a quack.
Yep.
Medical Board of California has been, people have reported me to the medical board because I have a differing opinion, mm-hmm. my local hospital institutions and so forth. So we're not just simply, our ideas are not being argued and debated. We're being attacked personally, mm-hmm. and we're being banned and shut down, social media, et cetera. And our ideas aren't even getting out there. And that's totalitarian. That's communism. That's not a free press and free America. And regardless of whether you agree with what I have to say, and I'm fine if people disagree, but disagree with evidence, banning what I have to say and banning thousands of doctors like me that have a different narrative, that's scary and that's wrong in my opinion.
Let's get into some scientific nitty-gritty. In case people are wondering, is Dr. Barke a guy who wears a white smock and has the stethoscope? Have you had patients with COVID-19?
I've treated dozens of patients. As a matter of fact, I treated a patient today with COVID-19. The key, in my opinion, to treating is treating early with mild symptoms, and then we're much more effective. The analogy I like that I think holds pretty true is, if you think about cancer, breast cancer, colon cancer, lung cancer, thyroid cancer, almost any kind of cancer, if we find that cancer early and we treat it, we're pretty good at it. If we find those cancers late after they've spread throughout the body, the bar is much higher to try to effectively treat, reverse, and cure that cancer. Mm-hmm. I think infectious disease is very similar. If we discover that virus when somebody has early mild symptoms and we aggressively treat it, I think we're much better off than what one narrative says. And I had a patient, the patient I saw just before you and I hopped on was just in my office. And what this patient was told when they called their doctor because they tested positive with COVID was, go home, stay well hydrated, take good care of yourself, isolate, and you let me know if the symptoms worsen, meaning we're not going to treat you. We're going to keep our fingers crossed that you don't get worse. And if you do get worse, cancer now has spread. Now we want you to go to the hospital for treatment. Mm-hmm. By the time you need to go to the hospital with this illness, it's really hard to treat it. Yes, we have remdesivir, which is a IV medication that acts as a RNA analog to try to muck up the virus replication. And it's not a bad product. And we have IV steroids and the like. Those mm-hmm. all are effective. But imagine if we have treatment early on in the early course of illness, when there isn't a huge viral load that is spread throughout the body, we're much better at treating it. I've treated dozens of patients with COVID. I have not had a single patient that has needed to be hospitalized, and thank God, knock on wood, I have not had one patient that died from this illness. The only patient I had that was hospitalized was a patient who wasn't a patient, but called me from the hospital. Wife did actually, mm-hmm. basically begged me to intervene and be his doctor when he was already in the hospital. Thank God he did fine. A couple weeks in the hospital, he recovered. But the path forward is the early intervention with mild symptoms, preparing the body for the virus by supporting the immune system with supplements, of course, taking care of any underlying illness that somebody might have, because we know from the CDC statistics, 94% of people that have died from this virus have had significant underlying health problems.
Yeah.
So if we look at this from, if we can treat those underlying health problems now, lose some weight, reduce stress, treat the high blood pressure, treat the cholesterol, etc., get some exercise, become physically fit, take some supplements, then we can better prepare ourselves that if and when we come in contact with this virus, we'll be in a position to conquer it, to survive, and to be okay.
I think you said something really important with the notion of underlying conditions. I got an email from an angry ER doctor. I won't say where or who, and he was suggesting that by having this Truth Over Fear summit, that I was denying that COVID-19 exists, or that I was underplaying the fact that people have died. And I wrote back to him, Doctor, first of all, thanks for your work. However, you're looking at the 2%ers here. You're looking at the Pareto principle. You're every single day you're dealing with the worst of the worst, but you're not providing any context. How old are these people in the ER? Are they obese? Do they have diabetes? Are they any underlying thing? And that's what the media does. They just throw out spiked, dire cases with no context whatsoever.
No, you're absolutely right. And I try to, every time I have the opportunity to speak to media, record a video, write a piece, is to emphasize, listen, every death, especially of a young person, is tragic. And my heart goes out to them. And I know people that have lost loved ones from COVID. I just spoke to a patient today who had an employee who died early on in the illness. It's a horrible situation. And we need to be really careful with people that are at high risk. But that high risk is very well defined. And if you look at the CDC's own statistics, don't take my word for it, Google it. And here's what I do when I update the statistics if I'm writing, is if you just simply Google CDC, COVID death, age, you'll get a breakdown of all the deaths and the age range of people that have died. And this has disproportionately affected older people. So if you're younger than 50, and the survivability rate of this virus is very high. And my focus has been, because I run, and I'm the board chair of a charter school, as I focus on children more, that if you look at the CDC's own statistics, survivability less than 20 years old, 99.997%. Now, what does that mean? It's just a number. Well, if you look at the number of deaths in the United States from children less than 15, there's been 72 deaths. Do not get me wrong. Those are horrible and they're tragic. If you're a family member, God forbid, a parent of a child who died, it's a horrible thing. But we need to, Patrick, put this into context. What are some of the other reasons why young people die? Traffic accidents, for example, kill about 675 kids every year. Drowning deaths, less than 5 years old, kill about 350 kids every year. Heck, influenza this season, 2019, 2020, has already taken 125 young people, 125 compared to 72 from COVID. We've never closed schools because of influenza. We've never required the masking of healthy children during influenza season, yet that's what we're doing with COVID. The argument, of course, in school is that, I get it that kids are at low risk, but the real concern here with COVID is that kids potentially could spread this virus to at-risk adults, and that's the rub, and that's why we care. But we've had studies that came out. There's a study that was published in The Atlantic, of all places, not exactly a right-wing journal, that looked at 200,000 kids in 47 different states. And the conclusion was that kids rarely get this, and when they do, it's mild or they're asymptomatic. And adults in schools are getting this at a baseline lower than the community. And in fact, they said the risk to adults in schools is not from the children, it's from being in the teacher's lounge and transmitting it adults to adults. There's not evidence that children transmit this to the teachers. There was a study out of Germany, this was, I think, last month, 2,000 kids, 13 schools, and it showed there's little evidence that kids get this or pass this on. As a matter of fact, the authors of that study concluded, and I'm quoting, it appears that children are a brake on infections to adults, meaning that children, because when they get the virus, they either have no symptoms, therefore they're unlikely to spread it, or their viral load is so low that they have mild symptoms, they're unlikely to spread it. It's almost like a little mini microcosm of herd immunity within a school to protect the adults. Yale did a study also that looked at child care centers. They looked at 50,000 child care centers in all 50 states, Washington, D.C., even Puerto Rico. Same conclusion. There isn't this super spreader effect that we were worried about amongst children. And so we have studies to show that children are not spreading it to adults. We clearly have CDC data, not Jeff Barke data, but CDC data that said kids are at very, very low risk. But yet here we are. Most of the schools in the United States are closed. We're harming our children. Yeah. How are we harming them? Well, highest teen suicide rate that we've seen in decades, child abuse at the highest levels, and reporting is down because many of our schools are the reporting agencies. Yeah. Depression is high, anxiety is high. Kids have more fear than they ever have. I had a kid who refused to go to school because they believed that they were going to die by going to school because of this virus. That's what they're taught. I had another kid that would come home from school and refuse to take their mask off. They had so much fear and anxiety. Yeah. They worried taking that mask off, they were going to kill their parents. Yeah. That's what we adults have created in our children. And I think it's unnecessary fear. My good friend Mark McDonald describes it as the fear and anxiety is so high that it's creating this delusional psychosis. Delusion is a fixed false belief, and it's creating this, and it's not necessary. And so America's frontline doctors and others are trying to put out a narrative that says, protect the most vulnerable and do so aggressively. But let's stop living our life with fear, and let's have a common sense approach to how we deal with this. And let's focus on the early intervention with mild symptoms and not the early anxiety and fear of shutting down our economy and locking ourselves in our homes.
True or false, Dr. Barke, the real virus is fear?
Well, there was an expression that we used to believe in, and that is the only thing we have to fear is fear itself. But now fear is turned into a virtue. Now we're taught that fear is a good thing, that if we don't have fear, if I walk down the street without a mask on, that somehow I'm doing something that's not patriotic, that it's patriotic to have fear and to mask up all the time and to stay away from public places. So true, the real virus is fear. And again, I don't want anybody to misquote me or to misrepresent what I'm saying. The virus is real and it's dangerous to those that are at risk, but it's not something that we should walk around with anxiety and fear and stress over. We should be prepared appropriately, but the fear is killing us.
If you've just joined us, this is a live stream hangout with me, Patrick Coffin, founder of Coffin Nation and the organizer of the upcoming Truth Over Fear Summit. You can sign up now. There's still some free tickets there at restoretheculture.com. Dr. Barke is our guest, board-certified family doctor here in Southern California and author of a book that you must get with someone I've been listening to for a long time. Dennis Prager wrote the foreword to this book. I'm glad to see it's now on Amazon for now, Dr. Barke.
It's on and off of Amazon. I don't know what they got going on. I don't know if they don't like my book like some of the other media outlets. You can find it by just Googling or searching on Amazon my name, Jeffrey, Jeffrey Barke. From time to time it says unavailable. I don't know why they do that. It can also be purchased directly through my publisher, and that's America's Group, and you can find it there as well.
Yeah, I also want to mention your website, rxforliberty.com. That's F-O-R, not the numeral, rxforliberty.com.
Both will work, actually, if you put the numeral in as well.
Okay, very good. Okay.
And a link to my book is available there, too.
Yeah, terrific. Let me ask you a question about prophylactic kind of preventative uses of some, you mentioned supplements. I want to talk about the world's first a drug that became a political hot potato, maybe because President Trump mentioned that he was taking hydroxychloroquine. What is your experience as a preventative and as a cure for COVID-19?
Well, I'll tell you, Patrick, as soon as we start talking about hydroxychloroquine, this video is now going to be banned on social media. So before we have this video banned, let's talk about some basic supplements that I do think are important, even independent of hydroxychloroquine. Maybe arguably the most important is vitamin D3. Many of us are deficient in vitamin D, and vitamin D plays an important role in immune function. So if you can measure vitamin D, you can go into your doctor and ask to have it measured and see if you're deficient, or you can just supplement with vitamin D3. Check in with your doctor before you do so. I generally recommend about 5,000 international units a day of D3. The other supplement that is important is zinc. Zinc messes with viral replication, so it's good to have into your system. Anywhere from 25 to 50 milligrams of elemental zinc, I think, is a good thing. Higher doses, sometimes even 50 milligrams, will cause some upset stomach. So use the lowest dose. The highest dose you can tolerate up to about 50 milligrams. The other supplement, too, that I take regularly is vitamin C, about 3,000 milligrams a day. And a really interesting supplement is melatonin. President Trump was on it. I take it every night. It's not a dose to help you sleep, although you can certainly use it for sleep. It's a dose to help stimulate your immune system. I take somewhere between 1 to 2 milligrams a day. Sleep doses is 5 to 15 milligrams in the evening. You can certainly do that with your doctor's permission if you're having trouble sleeping, but I'm talking about taking it for immune system purposes. And then finally, there's a supplement called quercetin, spelled with a Q, and that aids the zinc. It acts as what's known as a ionophore. It helps zinc get into the cell to disrupt virus replication. About 500 milligrams a day. You can buy these products at your local vitamin store. They're available on Amazon, etc. Now, hydroxychloroquine. Listen, most importantly about hydroxychloroquine is it would be hard to hurt somebody with hydroxychloroquine. And I believe that the studies show clearly that hydroxychloroquine can be an effective tool in the overall treatment. So I've used it fairly routinely from the beginning of this COVID season. The dozens of patients I've talked about that I've treated have all been treated with hydroxychloroquine. So far, all effective. Thank you. Thank goodness. And from a prophylactic standpoint, I know many of my colleagues think that it's a good thing, and the prophylactic dose is just once a week, 200 or some suggest 400 milligrams once a week. I have several of my high-risk patients on that. I think at best it may prevent the virus, or at worst, perhaps if you do get the virus, the viral load will be less. The virus will not be able to replicate as rapidly, and then we'll have time to intervene during the early mild symptoms. Now, if it was a treatment that was going to harm somebody, I'd be very cautious about using it. But it is a very, very safe medication. It's been around for 65 years. It's one of the most common treatments that we use for rheumatoid arthritis or systemic lupus. Patients take this drug daily. Millions of patients take this drug daily in a very similar dose that we use for treatment. And the treatment is only for 5 to 7 days. So I have not had any side effects or harm from using hydroxychloroquine. I think it's effective. Now, I don't mind if you disagree, and I don't mind if you show me studies that refute what I'm saying, but let's have a conversation about it. I'll show you my studies, you show me your studies, and let's find a path forward. If you don't want to use it, don't use it. But because it's a safe medication, it's over the counter in many countries. There was one presenter at our recent conference that showed evidence about the deaths around the world in various countries, and it lined up pretty closely with the higher deaths were countries that weren't using hydroxychloroquine, and the lower deaths were countries that had hydroxychloroquine readily available. Now, I get it. It's a correlation, not necessarily causation, but I thought that was very interesting. And I know the doctors, a lot of the doctors that are part of our group, America's Frontline Doctors, they all believe and have studied and agree that the evidence is compelling. It's not the only drug that we have to treat this, but it's one that's in our arsenal that I think makes some sense.
Now, what you just said has been, I'm thinking of the Allies going over Nazi Germany with truth bombs, and the other side immediately throw up, I was going to say skeet shooting, Scud missiles, but that's the Gulf War. They're throwing up flak. That's the word, flak.
Yeah.
And if you Google the H word, you're going to see recent studies. I want to say Lancet, possibly the New England Journal of Medicine, that identified some association with hydroxychloroquine, or let's just call it the H word because we don't want to get banned too quickly, with heart problems, cardiovascular threats. That was withdrawn, wasn't it?
It was, so the Lancet article came out and indicated that hydroxychloroquine was problematic. And the New England Journal had an article that came out as well. And James Todaro, who's a physician, ophthalmologist, and a researcher, did some background work on these studies. And he was the one that ultimately caused these articles to needed to be retracted. I've never seen it in my career that the two leading journals in the world, the New England Journal of Medicine out of the United States and the Lancet out of Great Britain, both within hours of each other, had to retract different articles about COVID-19 and hydroxychloroquine because they were flawed studies. And thanks to James Todaro, Dr. Todaro, did the research behind these studies and realized that it was flawed science and these studies had to be retracted. Keep in mind that when these studies were actually published in those journals, the World Health Organization stopped their hydroxychloroquine studies because they were convinced that it was a bad drug and so forth. But there are a lot of drugs that we need to be careful with as it relates to heart rhythms. It's not just hydroxychloroquine, and we use them routinely. Some of the macrolide antibiotics, the fluoroquinolones like Cipro, and others can cause arrhythmia problems. So listen, this is what we do all the time. I treat patients with this all the time. I monitor their heart. I do EKGs. I look at their history. I evaluate their situation, and I make a risk-benefit judgment with the patient's input about whether treatment A or treatment B is better and the path forward. We do this all the time, and we use medications off-label all the time, including hydroxychloroquine. Hydroxychloroquine use for COVID-19 is off-label, and it's not controlled. It's not like Vicodin or OxyContin, or some of these drugs that require specific special prescriptions because they're federally controlled. Hydroxychloroquine is not controlled. It'd be like, I don't know, writing an antibiotic if you had a tooth infection. Easy to do. I can call it in and so forth. And I might write for a drug that is off-label, not designed for its specific use. We do that all the time. That's the art of medicine. Yet when it comes to COVID, we're criticized when we want to do that, and we're called names, and our licenses are brought into question. And it's very unfortunate what's happened.
One of the other presenters at the Truth Over Fear Summit is State Senator Scott Jensen. I'm sure you know, physician, and he's got the sort of Damocles hanging over his head because of his challenging cause of death on death certificates. That's another end or another element of this story that's disturbing for doctors of conscience who don't want to put down the official death cause if it's not warranted. If it is warranted, of course, it should be.
Sure.
It's another a layer of pressure applied to doctors.
Yeah, and I believe Dr. Jensen is now being investigated by his local medical board,
right?
Because he's saying things that they don't like, and it's so unfortunate. He's practicing medicine, and they don't like what he's saying, so they're investigating him for unprofessional conduct or something.
Yeah. Let's turn to some questions here. This is an interesting one. Hey, Patrick, Google is tracking your site with a warning sign. The sign says your site is known for radical views, like not walking on the moon. See, some of this, it's so over the top. It's accidentally funny. Another question here. These are all fake names, so I won't mention the names. No scientist or doctor who ever made great discoveries throughout history succeeded with the totalitarian media shutdown like has been done on these good and honest doctors and scientists. The totalitarian impulse is a theme in just about every other question here in front of me, Dr. Barke. People with eyes to see can see what's going on. This is not just a normal flu season. There's some other macro meta thing going on that people are trying to work through.
Yeah, you're right. And I tweeted this out earlier today when I realized that all our videos, including mine wasn't controversial. I was talking about the path forward to opening up schools, and I gave some ideas about what are some things we should think about and what are some strategies for opening it up. There's nothing controversial about that. Yet, as I saw literally all our videos, I think there was 12 presenters. I can't remember. Every single one of them has been banned and shut down. I tweeted this out. Disagree with me, disagree with America's frontline doctors and our positions. That's cool. That's America. But ban us from having a voice, that's totalitarian. That's Chinese Communist Party stuff. That's North Korean stuff. That's not America.
Here's Timothy Henwood. It piggybacks on what you just said, Doctor. Science is now a religion. So any wiggle room, which is the pillar of scientific theory, is blasphemous.
Yeah, that's right. The scientific theory is not about having a unilateral, unchallenged position. The whole scientific theory is about putting forward a hypothesis and then challenging that and trying to disprove that hypothesis. The more ideas we have, the better. The more dissent we have in science, the better. We challenge each other to be better, to look at data maybe that we're not aware of. That's how we move forward. That's how every single scientific discovery has been made. That's how we make progress in science and in medicine.
Let me ask you a question that I don't know if anyone has the answer to definitively, and that is, why is COVID-19 different? Why is this a global lockstep totalitarian impulse, oligarchic control thing? Because it's for people who've been, around the mulberry bush. You and I might be around the same age. I remember for lack of a better phrase, I'll call it fear porn. Back in the 1970s, there was the coming ice age. Leonard Nimoy did the voiceover for a documentary on the coming ice age, and they were convinced any minute now. It was on the cover of Time magazine as well. Right. We are in for a coming ice age. And then, of course, it was AIDS, and everybody's going to get AIDS. And then it was Ebola. I'm saying these out of order. SARS, Zika, H1N1, swine flu. It's like a new media fear product. And of course, certainly, I was going to say COVID stands in that tradition, but this is of a much greater order. Why?
I think the reason why it's different is because our media is different. So never before have we had social media like Facebook and Twitter and Instagram and YouTube. We didn't have that 10 years ago, certainly not 20 years ago. So ideas are broadcast around the world almost instantaneously. And the power bases of these social media companies are of one ilk, right? So there isn't a there isn't a right of center Twitter outlet or Facebook outlet or Instagram outlet. They all are of one political thinking. And I think that's the problem. So it's different this time because of social media. Before in the late 1960s, we had a horrible flu that broke out. You know what we did in the middle of it? We went to New York and we held a Woodstock conference, Woodstock festival for 2 days, right in the middle of a horrible viral illness that killed thousands of people. I think by today's population, I haven't looked at this data recently, so I forget, but I think by today's population, it would have killed about 130, 140,000 Americans. We didn't shut down the schools. We didn't shut down businesses, maybe because we didn't have social media, and we partied. We went to Woodstock and we partied. So now I'm not suggesting that we should do that, but we shouldn't be taking a fear-based approach to how we handle this virus, because I personally think our reaction to this virus has caused more harm than the virus itself, in that we have unemployment high, depression high, suicide high, and this is disproportionately affecting the lower socioeconomic class. They don't have the resources to survive. They can't access mental health like wealthier people can. They can't open up micropod schools, hire tutors, etc. And it's disproportionately affecting them. And so the same people that claim that they want equality and they want equity are causing the most inequality and the least amount of equity because of the fear mongering that's occurring as a result of this pandemic.
I've been called a fear monger on Facebook. I mean, I'm trying to provide the antidote to the fear mongering. Have you been tagged with that devil term, that you're a
Oh yeah.
fearmonger?
Oh, absolutely. I've been called all kinds of names. My wife and I both, actually.
Mm,
And I think the answer is having this kind of a conversation. And in a perfect world, what we would do, maybe what you should do, is find some people that have very different views than my views and bring them on, and we will politely discuss.
yeah.
We'll present the evidence. We'll look at the scientific data together. We'll have a conversation. My mind might be changed. My opponent's mind might be changed. But I think what we all can agree upon is that the way forward is to have a civil discussion with people with different scientific views. That's how science progresses, not by shutting each other out.
Mm-hmm. Here's a observation from Nicholas Maselli. The problem is most citizens are not scientifically trained. This is a really important point, I think, because you've got pundits who are not MDs on all the major alphabet soup
Right.
networks, sounding like they are with the new terms flatten the curve and dire spike and so on. So was it Mark Twain who said, figures don't lie, but liars do figure? There could be a lot of fuzzy, I call it word salad, that
Right.
sounds quasi-scientific, and people
Yeah.
go, yep. Like, because I guarantee you, there are some people listening who've been watching you and I for the last 40 minutes or so who are nodding and nodding and nodding, but they'll go straight to their mask, and they'll wear the mask in their car with gloves on, with the windows up. It's a back to Dr. McDonald's description of it as a delusion. That's not an overstatement. It's brain lock on this false idea that's really, really hard to dislodge.
Well, we certainly, independent of COVID, we certainly know that fear and stress are not good for our body, and it clouds our thinking. I mean, just think in any situation in your life when you're feeling most stressed and you're feeling fearful,
Yeah.
you don't make good decisions. It's hard to have logical conversations. Here's a perfect example. If you're married, I've been married for, I should know this. Hopefully my wife isn't watching.
At least several years.
It's 35 years, I think, right?
Congratulations.
So, and you know what it's like if you're married when you are arguing with your spouse, and sometimes it's heated, right? Are you effective at having a conversation when you're upset? You know, when you're talking about something that's heated, are you effective? No, you're not. And that's why, by the way, there's marriage counselors. So you can step back. The marriage counselor can moderate, can hear your perspective in a quiet, calm voice, can hear the other spouse's perspective. And that's what we're not doing. We're yelling at each other. The public is feeling the fear. They're reacting to the fear in what I think is correct, Mark McDonald's thought, in a delusional way, meaning we're so fearful that our ideas that are incorrect have been fixed and they're false. So whether it's a mask or just the fear of the virus not going out of our house, we've been taught it's okay to go on an airplane for 5 hours to fly across the country. But if you want to go to church for an hour on a Sunday, even if you wear a mask or socially distance, that's dangerous. But flying on an airplane for 5 hours, that's not dangerous. We can stand in line waiting to get into Costco. I've done this. That's perfectly safe. But if you want to stand in line in 12 days to vote, somehow that might be dangerous. Yep. We're not making any sense. Yeah. We're being very arbitrary in some of our decisions. And I think we're doing that because we're not thinking clearly, because we're so fear-based and anxiety-ridden as a result of what we're seeing on TV.
Another inconsistency I've noticed, to me the most blatant one, is you go to the restaurant and you're talking to the hostess and you have to wear the mask. Hey, put the mask on, sir. Put your mask on. But then 12 seconds later, they seat you at a table 7 feet away, and then you can sit down and take your mask off.
Yeah, unless you go to Basilicas in Huntington Beach.
I'm going to be going to Basilicas in Huntington Beach. I want to shake Tony Roman's hand and buy his food. And this is a now nationally famous restaurateur who's just had enough. And I think the oligarchs have picked on the wrong guy. Yeah, very brave restaurateur. I don't think he lets you in with your mask on.
He's perfectly fine if you want to wear a mask. And he, tongue-in-cheek, has a sign posted that says, put down your mask, have a cannoli. And so, you know, he doesn't mean to say that you can't wear a mask. If you're comfortable and you want to wear a mask, but you're perfectly permitted to go inside without a mask. His waitresses and waiters don't wear masks, and it's really a weird feeling when you go in there. There's this feeling of liberty and freedom, and also, by the way, the food is really good.
Yeah. I'm not an affiliate or anything. Neither are you. What's the name of the restaurant again?
Basilicas. I think that's it. And it's in Huntington Beach. If you were just to Google Italian restaurant, Huntington Beach, masks, it'll come up.
Yeah. Wonderful. Yeah. I'm glad you mentioned that. And I think my summary of it was totally media drenched, that this is how they've tagged him. He's a grandma killer. Right. He will not let you wear the mask.
Yeah.
To the masks briefly, efficacious at stopping the spread, either from mask wear externally or vice versa. Worthless.
The mask hill is not a hill I want to die on. I really actually don't have a problem if somebody wants to wear a mask and they feel more comfortable. The science is fairly mixed. I don't think that there's good scientific data to support the masking of the healthy population as a mechanism to reduce the virus. I certainly support a private business's right to determine the conditions under which you can patronize that business. So my wife and I go to Costco, they require masks. We wear a mask if we want to go into Costco, et cetera. And me as a customer, I have a right not to go into Costco if I want to, and I don't like their policies.
Yeah.
So if you want to wear a mask, wear a mask. If you wear a mask in your car by yourself, I think you need to see Dr. McDonald. There's something wrong with you.
Yeah.
I think it's unhealthy for children to wear masks, and I don't think anybody who's exercising outside should have a mask on. I'm a bit dubious about the claims that somehow a mask is going to impact the virus significantly. But I personally, I carry this thing around with me mainly because I don't want others to feel upset. And out of respect for them, I will put one on when it's required of me. But when I'm out in public with my wife, when I'm by myself, I don't have a mask on, and I'm not fearful of the virus. And if masks work so well and you want to wear a mask, don't worry about whether I wear one.
Sure.
And the early intervention of mild treatment is what I'm focusing on. And if you want to wear a mask, have a mask. But I don't think the government should be mandating the masking of a healthy population.
I just saw something in a comm box. It was a quarantine is when you isolate the sick and the vulnerable. Tyranny is when you lock down all of humanity, and stupidity is not seeing the difference.
Yeah. Well, traditionally, that's what we've done during infectious diseases.
Yeah.
We quarantine those that are sick. Maybe you could argue that those that are at very high risk should be quarantined, or at least should use extra caution. But we've never quarantined the healthy, and we've never required the masking of the healthy population. Yeah. I think personally that's a mistake.
Right. Well, I want to respect your time. I think it's a great summary or sample of what people can, just one sec. What they can expect at the Restore the Culture conference. Go to restoretheculture.com. It's called Truth Over Fear: Unmasking COVID-19. Dr. Jeff Barke is going to be doing a presentation and answering additional Q&A. I've watched his talk. It's phenomenal. And we're not just going to hit the masks and the H word, but also the legal aspects. Did any legislature ever meet here? Is this a legal thing, or is this something that comes down from mayors and governors? We're going to talk about the spike in suicide, the other pandemic, with Dr. Aaron Cariotti, who is a teaching psychiatrist at UC Irvine. Also, Dr. Rashid Buttar. And you can go to the website and just I'll give you a couple more names here. Dr. Simone Gold, the founder of America's Frontline Doctors, the psychiatrist that we mentioned, Dr. Mark McDonald, State Senator Scott Jensen, Mickey Willis, who produced the Plandemic 1 and 2 documentaries, is going to be presenting a very interesting thesis. Same with John Waters. John is the official chronicler of the rock and roll band U2, and he's got lots of interesting thoughts on viral entrancement and how the media have
I look forward to joining you.
Excellent.
And I look forward to hearing the other speakers. It's going to be fantastic. Thanks so much for having me.
Appreciate it. Thanks for your time. All right. Very good. That's you too. Dr. Jeff Barke, thanking him. And I want to thank you for listening in. We do this once a month. It's a live stream hangout. And thanks for all.